Hello everyone, I am Dr. Abhijit Valsa and I am consultant gastroenterologist at Kailash Hospital Dehradun. My main areas of interest is luminal gastroenterology that includes disorders of digestion, constipation and etc. Today in this video, I will be talking about one of the important issues, inflammatory bowel disease. So inflammatory bowel disease includes two predominant diseases which are ulcerative colitis and Crohn's disease. So first, what is inflammatory bowel disease? Inflammatory bowel disease is an autoimmune disorder in which your own immune system goes haywire and attacks your intestinal tract. That is from mouth, esophagus, stomach, small and large intestine, and sometimes anal canal. So Crohn's disease involves all of the gastrointestinal tract in discontinuous manner, while ulcerative colitis is restricted to your large intestine. These two are the major compromise the major chunk of inflammatory bowel disease. So, what are the symptoms of these diseases? The most common symptom is abdominal pain, and it is frequently associated with diarrhea. Many times there is a blood in the stools, and you need to go multiple times, and sometimes only blood comes as a stool. So these are the predominant symptoms. Other minor symptoms which may occur in subset of patient is fever, loss of weight, loss of appetite, and other non-constitutional symptoms like not feeling well, sometimes jaundice, complications involving the eye like conjunctivitis, uveitis, sometimes even cataract. The most common associated symptoms with inflammatory bowel diseases are arthritis. It can involve literally any joint, but mostly lower back pain and the knee pain. These are the most common things. What causes IBD? Nobody knows the answer to these questions. So there is no definitive proven cause for the IBD. The theories which are supposed to cause IBD are genetic predisposition. There are certain genes which are involved in immune regulation. They are not functioning properly, so the immune system goes haywire and it causes the inflammatory bowel disease. This is the most accepted theory, but there are many like some says antibiotic use during the pregnancy and the childhood. There is a hygiene hypothesis which says that no exposure to other antigenic stimuli may cause immune system dysregulation, but these things are not proven. How is IBD diagnosed? Inflammatory bowel disease is basically suspected on the clinical ground based on the symptoms and associations which I just discussed. The diagnosis is essentially based on the colonoscopic finding and the biopsy. In the colonoscopy, we see in the mild cases there are just minor ulcers or hyperemia of the intestine and mucosa, or sometimes there are ulcers which may vary from 2 to 5 to the larger ulcer which may involve the entire large intestine. So we take biopsy from this affected area, and there is a inflammation, essentially chronic inflammation of the intestine. In ulcerative colitis, intestine only large intestine is involved. In ulcerative colitis, whole the GI tract right from the mouth to anal canal can be involved. So based on the location of the involvement, we need to get endoscopy and the biopsy. So the diagnosis is established only after compatible clinical picture on endoscopy and biopsy. So once the diagnosis is confirmed, how do we treat this thing? So basically, this is a disease like diabetes and hypertension with no definitive cure. Once diagnosed, you have to continue treatment for the rest of your life because this is an immune dysregulation disorder. It has to be kept in check for the rest of your life, otherwise, other complication may ensue. So, treatment is fortunately tablets. The most commonly used tablet is a mesalamine, which is used orally twice daily for ulcerative colitis, and oral steroids for Crohn's disease. There are other medications which are given once this disease is controlled. In severe diseases, steroids, tablets, or injections are required. And in some cases, other medicines like biologicals, infliximab, adalimumab are required. So the treatment depends on the patient to patient and needs to be monitored and tailored accordingly. So the most common question which comes in our mind is what to do about the diet and lifestyle modification. So this is like a controversial area. Many doctors suggest extensive dietary modifications so that the patient's nutrition is sometimes compromised. So my personal opinion about this is just to restrict dietary dairy products during the flare-up. So once your intestines are become normal, your bowel pattern normal, I generally do not advise any dietary restrictions unless patient is having problem with that. So if you are having pain abdomen or your diarrhea restarts after taking certain food, most common are nuts, non-veg items like fish and milk and the other dairy products, then these to be restricted selectively if you are not if you're intolerant to this. Otherwise, personally, I don't advise any particular dietary restriction. And lifestyle changes, it is always better to have a healthy lifestyle, regular routine, sleep on time, eat on time, do some exercise. And the only proven thing which helps is smoking cessation in patients with the Crohn's disease. If patient with Crohn's disease continue to smoke, nothing works, and this patient develops many complications. So the smoking cessation is the only thing, only proven thing that helps in these patients. As I said, this is a lifelong condition, and it sometimes flare up. Even with continued medication, good healthy lifestyle, adherence to the dietary restrictions if there is any, patient may get flare-ups. Most of the time, there is a discontinuation in medication, which is a commonly most common factor. Sometimes intestinal infection, which generally we get from the food and water, they cause the flare-ups. Sometimes there is no cause. Despite everything going well, patient just get flare-ups. That is the part of natural history of the disease. So what can be done to reduce the chances of flare-ups is continue good compliance with the medicine. You should not skip doses. You should be taking medicine on time. Eat and drink food from the home preferably. Avoid outside food, which may give you infections. So these are the two things that can be done and that can be helpful to prevent the flare-ups. But the flare-ups which are immune system related, there is no 100% way to prevent this. So you are bound to get few flare-ups once or twice a year, and that is a normal and should not be worried. One should not worry too much about. The last part of the last part of the discussion is during this COVID second wave, what to be done. So there is nothing more than the standard precautions like not touching to your nose and mouth with your hands, frequent washing of your hands with the soap or sanitizer, whatever is available, wearing the mask most of the times, avoiding crowded places. The standard precautions for the COVID, they apply for the IBD patients as well. IBD patients are on immune modulator medication, especially if patient is on steroid, they are likely to contract the infection. But however, patients with COVID, the steroids are indicated in the treatment protocol. So in the practical world, in the real world scenario, this doesn't make any difference. So patients with IBD, especially if they are well controlled on the medication, they shouldn't be worried. They should continue to take their medication. They shouldn't be afraid excessively. They are at the same risk as the general population. So just stick to the standard precautions, take your treatment regularly. That should be all. Thank you.